So I'm making this video as a way to chronicle what has been happening in my life. Um, I don't have a life-threatening disorder or illness. However, the disorder that I have makes my life difficult. It just alters the way that I'm able to function throughout life. And I had a wake-up call. Actually, yeah, I had two procedures that because of the resulted from having this disorder. And the first procedure I had last year, and the second one I had at the beginning of this year in January. I didn't feel like I had control over myself. And I did not like the way that the medication made me feel. I felt that the medication kind of set me back as far as like my goals, my health goals, and the things that I really wanted to invest in me. And one of the things that I heard in a speech actually today, that a lot of times people don't take enough time to invest in themselves. They invest in other things, other people, but they don't invest in themselves. And one of the most important ways that you can invest in yourself is by taking care of your health. Without your health, you are unable to participate or fully participate or give up yourself in other areas. Maybe if it's spiritual, maybe you like volunteering, maybe you have children. You're not really able to give up yourself if you don't have good health and function at a full level for me, which may not be the same for someone else, but being able to function at a higher capacity than what I'm used to functioning, which may be down here, I felt that it's important for me to make some changes. And so, but that wasn't the case. I had to have another procedure, and that just kind of just put me in a very negative space mentally, as far as not really expecting to have to go through another procedure. So after that procedure, I made a commitment to myself, made a promise to myself that if I came through, that I would work really hard to invest in my health. I'm celebrating. I This is in the making, probably for like 6 months. My husband and I went away, and we don't have a lot of money. So sometimes, like, when you start to embark on a very healthy journey, it can be expensive. And I know people say, well, having cancer or being sick with diabetes and things like that and taking medication is expensive. In the long run, it is. But sometimes people aren't making these choices, healthy choices. Sometimes people aren't making healthy choices, not because they are lazy, they don't want to see themselves in a better position physically, not because they just, well, eating bad sometimes is enjoyable, but sometimes it is a financial thing. And if anybody dismisses that, they're not really being realistic, and they're discrediting a whole segment of people that really financially things may be difficult for them. Eating healthy can be expensive, but you have to strategically do it. Eliminating certain products out of your life that cause toxicity can be difficult. However, if you strategically do it, then you can see a tremendous change in you and in your life, and it becomes easier. The first step is always the hardest. And some ways that I did it, and I haven't completely eliminated everything, but I'm on the pathway that once my finances get to the point where I want, where I'm comfortable at, then I definitely know I've set the foundation and established that foundation in order to move forward. But I'm celebrating because my husband and I, we had the opportunity to go away, and for 1 week, we lived our lives as perfect as we could, as far as like not having any not having any processed foods. We all our cleaning products and supplies, personal supplies, were no kind of contamination and things like that. Just the way that, it's always promoted on how we should do, which may be difficult for some people. But we were able to reach that point through planning. It took us 6 months to get like certain supplies and things like that, and then during the week that we went away, we juiced, and then we had light meals, so it didn't put a big burden on our bodies. So I'm very pleased. We exercised every day, exercise most of the days, and we went really hard. We had, made a goal that we would go there to eat healthy, live clean, exercise, and we did it. And for that alone, being able to live 1 week like that, that just really, really just made me ecstatic, as far as being able to see how you feel to live the way that you want to. And you may not be in a position to do it all the time, but if you pick one area in your life that you want to convert over to eating healthy or living in a healthy lifestyle, eliminate one thing and substitute it with something that you like to do. You may not be able to do everything. Some people have those favorable situations where they can convert over their whole life over to eating healthy, living clean, and things of that nature, and making products. But if you pick one area in your life where you want to eliminate certain things, then that's good. That's a breakthrough. Don't compare yourself to what other people can do or how other people are living their lives, especially if it gets you stressed out because you have to eliminate so many different things from out of your life, and you have to change over your life to fit a certain protocol. Work up to it. Do it in stages, and eventually you'll get to a point where you're successful. And then also realize too, there might be a point in time where you may backslide because it's new, and also, but if you take your time and do it progressively, you're more likely to stick with it. It's better with support. And if you don't have support, there's so many different groups online that you could seek encouragement from. So many other people that are just like you, that are struggling with health issues and different, even financial issues. health should not be just limited to people with a particular means. You know, it's possible for everyone to change their health, put themselves in a position, pivot themselves in a position where you are going to benefit from healthy things or changes in your life that allow you to be healthy. Um, Even if you backslide, you know that you've done it before, and you can just evaluate what you did this time that you need to change, and look at it as a personal journey. Only you know how you feel and what things that make your body feel better. And it's not going to be like processed foods, things that will contaminate your body. If you support your body, give it what it needs, feed it well, it's going to work really well for you. It's going to give you the results that you want. And with that being said, I am celebrating because when we went away that week, um, which was last week, I lost 13 pounds. So that's phenomenal, especially with the endocrine disorder that I have. It makes it very difficult to lose weight. And my primary focus wasn't even on losing weight. It was mainly on being healthy. That's always been my goal. Is to get my body in a state, in my life, in a state where it's healthy. And that I'm able to do what I want to do in life. Because there's so many things that, and I'm sure anybody, things that I enjoy doing and I want to accomplish. So I need that health. I need that vitality in order to perform at my best and do everything that I need to do in life. So I'm celebrating, I'm happy. I know that this is going to propel me forward to better things in life. I've accomplished a lot of other things in my personal life, but being able to be healthy, to engage in those things fully, is only going to take me even further in life. Thank you.